There's an ongoing push to bring psilocybin therapy to New Mexico. Psilocybin, the active ingredient in psychedelic mushrooms, is federally illegal. But advocates say that psychedelics, specifically psilocybin, can help treat individuals with certain behavioral health disorders. Chad Lozano is a veteran and suffers from PTSD related to his deployment in Iraq. He's an advocate of cannabis and psilocybin, and said he avoids prescription medication due to the harm that it's caused to his family.
My oldest sister, she was a veteran herself, and she actually passed away from prescription pills from the VA. And so after she passed away, she was on pretty much all of those and some. I swore to never do that to my parents again. So I've actually told the VA no to all of them, just for the simple fact that I didn't want to go that route.
Currently, only 2 states have legalized psilocybin, but there's ongoing efforts to study the effects of the drug. According to a study conducted by Johns Hopkins University School of Medicine researchers, 54% of participants diagnosed with major depressive disorder were considered in remission 4 weeks after receiving psilocybin treatment. Lozano echoed this sentiment, saying that psilocybin has been beneficial to treating his own PTSD.
With psilocybin, I feel the effects even days after, I've stopped taking it. And it's not like I'm feeling high or anything, it's just I'm getting the benefits of, it's like you learned something, and then you took something from that, and it sticks with you for a little bit.
When KRWG reached out to the New Mexico Department of Health regarding Senate Memorial 12, a spokesperson from the department sent back a written response. Quote, "While Senate Memorial 12 does not allocate any funding for the work, it aligns with the objectives of the New Mexico Department of Health in addressing addiction within the state. Consequently, NMDOH will strive to identify and report on research and program models implemented in other states to inform and support future plans." As a Schedule I substance, the DEA says psilocybin has no currently accepted medical use, and there are reports of individuals reacting adversely to the substance. Research on how safe and beneficial psychedelic treatments are for the general public is ongoing. And while medical providers in New Mexico aren't allowed to prescribe psilocybin, there are doctors in the state practicing other forms of psychedelic treatment. Dr. Deb Thorne, co-owner of Soul Trip in Las Cruces, is an advocate of psilocybin treatment and actively uses ketamine therapy with some patients.
I actually went back to Canada to receive some training for psilocybin-assisted therapy. And so, coming back to the US and coming back to the state of New Mexico, I continue to use ketamine because it is legal, but I am not able to use psilocybin, which is one substance that could help thousands in this state.
Dr. Thorne said psychedelic treatment could help ease some of the burden on New Mexico's current behavioral health landscape. And while it's not for everybody, it's a tool that can be used to treat individuals who qualify.
This is a powerful adjunct therapy to the mental health industry. And I think that we just need to be open to the possibilities, but do it safely. We need to look at the medical model. We know that cannabis has been received well in that light, and I think we need to look at psilocybin as being, equally, a similar path, anyways, to legalizing it for the state if we use it for medical purposes.
Leanne Meadows is one of Dr. Thorne's patients who's undergone ketamine therapy. Meadows said that she has PTSD from trauma that happened when she was a child and that she wasn't making meaningful progress in traditional therapy.
This medicine has helped me to change the way my brain works. I was really able to change the quality of my life and improve the quality of my life through these treatments. And so I think there's a place for psychedelics for people that have been traumatized.
With the momentum gained from this legislative session, advocates are hoping to push for a medical psilocybin program following a similar model of the medical cannabis program so that progress can be made in treating complex behavioral health problems within the surrounding communities. For KRWG Public Media, I'm Johnny Coker.